Good afternoon. My name is Daniel Chapin. I'd like to present a case review for you for Unit 7 of Fundamentals of Graduate Study in Psychology. For this case review, we're going over the case of Jason, who's a 37-year-old male veteran residing in Costa Rica. His mental health history includes prior diagnosis of bipolar 1 disorder following a psychotic episode in 2020. Jason experienced significant childhood emotional neglect, parental rejection, institutional trauma, and a behavior modification program that has since been shut down during the ages of 15 and 17. He served 11 years in the Army, which exposed him to additional trauma, contributing significantly to his psychological state. Jason identifies as between INFP and INTJ. He fluctuates between these two according to Myers-Briggs personality types. He is very introspective, intuitive, analytical, strategical in thinking. He engages in various hobbies including writing, poetry, lifting weights, reading extensively, immersing himself in nature, and exploring philosophical topics from an integral perspective. He has a low risk of self-harm or harm to others and maintains functional capabilities, though he prefers flexible employment, fringe jobs such as psychological coaching, and he is supplemented in his income with disability compensation by the VA. His personal strengths include tenacity and self-motivation. So, Jason has been diagnosed with borderline personality disorder according to DSM-5 guidelines. Clinical observations and history assessments were also employed during the diagnosis. Also, he was diagnosed with bipolar disorder, as we mentioned earlier. And borderline personality disorder is characterized by significant emotional instability, difficulties with emotional regulation, unstable interpersonal relationships, marked impulsivity, and chronic feelings of emptiness. It's basically a fragmentation of identity, and there's various perspectives of how that forms. One perspective I'm more aligned with is that it's a defense mechanism for trauma and neglect during childhood, which is something that Jason did experience. He has exhibited signs of relational instability with extreme oscillations between idealizing and devaluing partners as a defense mechanism. His interpersonal relationships shift rapidly between intense closeness to dramatic conflicts, reflecting impaired personality functionality central to BPD. He has demonstrated substantial impulsivity through risky sexual behaviors and poor financial management. He engages with psychedelics approximately 1 to 2 times per year. These behaviors align with heightened emotional dysregulation, typical of BPD. Symptoms include rapid mood fluctuations across anger, anxiety, euphoria, consistent with clinical presentations of BPD. Struggles intensely with feelings of emptiness and existential dread, and that's exacerbated by identity confusion, lack of self-image, coherence. Central to BPD is the fear of abandonment, and this frequently triggers anxiety-driven impulsive decisions to cope with that fear, significantly disrupting daily functioning. As for etiology, Jason's BPD aligns with biosocial models proposed by Marsha Linehan, who developed dialectical behavioral therapy, where a genetic predisposition to emotional dysregulation interacts negatively with chronic environmental invalidation, notably parental rejection and emotional neglect in childhood. This is exacerbated by his experience at the behavior modification program along with the military. So we can go to treatment recommendations. For BPD, dialectical behavioral therapy is the most preferred. There is schema therapy as well, which works to address emotional schemas from childhood trauma to foster stable identity formation. And his interest is already formed towards Jungian psychotherapy, so that could be of interest if his goal is also individuation, which is in coherence with Jungian therapy. So, of the prognosis for him, he's got a favorable prognosis because he has a high level of self-awareness, psychological insight, intellectual capacity, and is actively engaged in therapy at the moment. And yeah, that's the wrap up of this case study. To dive more into borderline personality disorder, it's an interesting topic. I think that's very under-researched. There's a lot of talk right now too of looking into complex post-traumatic stress disorder and if that is borderline or if it is not. And the differentiation is not very clear. What I've found is that there is often a comorbidity between those who have PTSD and borderline of about 30%, and that's in accordance with other studies that have been conducted. I don't have the citation right now, but yeah. How would I go about treating this client is to really address, where is the emotional and personal core? What are the values and how does he construct his worldview along with his own philosophy, and where that naturally aligns, and how we could help foster a greater emphasis upon that core. So with borderline personality disorder, the issue is that there's a lack of core identity, and how do we get Jason to bring himself back to that core identity? And that could be back through observing childhood and the interests that he had during childhood, and develop them further as well into more mature interests that would be more suitable for his social life and every other applicable aspect of his hierarchy of needs. So that's my case study. That's how I would treat this client, and it's brief, but that's what I have. Thank you.